Hi, everybody. Welcome to this week's Marrero Psychology Toolbox. And today I'm going to talk to you about 7 steps to better sleep. All right, everybody. Tip number 1. Let's talk about what you should and should not use your bed for. Take a look at the pictures here on the left. On the top left, you'll see 2 people, well, having a good time. To the right of that, you'll see somebody working in bed. Below that, you'll see a woman on her iPad. And then to the left of that, you'll see some puppy sleeping. Take a minute to decide what you should be using your bed for. I really should have the Jeopardy song here. All right, everybody. So if you guessed this one and this one, absolutely. This one and this one, we absolutely don't want to do in bed. And here's why. When we work in bed or do anything that is not sleep or sex in bed, then we start associating our bed space and our sleeping space with more active activities, which is going to make it harder for you to sleep at night. So in the future, if you're going to work, go maybe to the dining room table, set up an office somewhere else, or keep it at work. Tip number 2. So let's say that you've been working a lot lately, or you've been working late lately, or even that you've been on a fantastic vacation and you just haven't been getting a whole lot of sleep at night. What do you do to reset your sleep cycle? Do you go ahead and sleep in the morning, or perhaps go to bed early, or both? All right. Well, it's actually really important to wake up at the same time every day. And here's why. Our bodies are tied to our circadian rhythms, which are about a 24-hour cycle, and it resets in the morning. So if you try to sleep in to catch up on rest, then what that actually does is push your circadian rhythm a few hours later, and then that makes you sleepier even later than you normally are, which pushes your ability to wake up the following morning even later. And you can kind of see how this gets to be a cycle. So if you want to reset your circadian rhythm to get better sleep, it's really important that you wake up at the same time of day, no matter what day of the week it is. Tip number 3. All right, now I know if you're like me, you probably love a good cup of coffee or tea, or maybe even a glass of wine with dinner. But here's the thing, consuming any substances or certain substances too close to bedtime is really going to impact your sleep. So a good rule of thumb when thinking about, for example, caffeine, is not to have any afternoon. Have your coffee in the morning, have a glass of tea with lunch, and then after that switch to decaf. And then thinking about alcohol, avoiding it before bed may seem counterintuitive, because I've absolutely heard of people who said, I can't sleep, and so they maybe get up and have a glass of wine. And this may actually put you to sleep a little bit earlier, and that sounds fine, but the problem is later. So a few hours into your sleep cycle, it actually is going to cause you to have more sleep disruption, wake up more frequently, and get a poorer quality of sleep. So even though it might help you fall asleep, it will not help you sleep better or get better sleep. All right, well, we all know that exercise is good for us, and you're supposed to do it every day, or at least more days than not. And it definitely impacts the quality of sleep and how easy it is to fall asleep at night if you get regular exercise. But one of the things you really should consider is what time of the day you exercise. So you may or may not know that if you exercise, or when you exercise, your body actually releases cortisol, which is our stress hormone. And if you are exercising too late in the evenings, you're going to be still coasting high on the cortisol rush when you're trying to go to bed, which will make it a lot harder for you to find sleep and get rest. So if you're when you exercise, go ahead and do it in the morning, early afternoon. Don't do it before bedtime. Tip number 5, napping. Now, I love a good nap, especially on a cold and rainy day. I love sinking into the covers, plumping up my pillow, and just taking a good long snooze. But there's a catch. So if you're somebody that struggles with sleep, napping can really have a negative impact. So if this is you, keep your naps down to 20 minutes or less. And that's because if you sleep much longer than that, you're going to start going through sleep cycles, which is going to disrupt your sleep further. And it's also perhaps a good idea to consider not napping at all. That way you'll be tired in the evening. All right, let's talk about tip number 6. So riddle me this. Imagine you are in the bed and you were trying to fall asleep at night and it's been about 15 or 20 minutes. Or maybe you've woken up in the middle of the night and same thing, you haven't been able to fall back asleep and it's been about 15 or 20 minutes. Look at the pictures to the left and tell me, what do you think is going to be helpful if you're having this problem? Top left, we have a woman sitting quietly in the dark in a chair with what I'm going to assume is chamomile tea for the sake of this argument. To the right, we have a man lying in bed thinking thoughts. Below, we have a woman holding onto her iPad. Perhaps she's checking Facebook or email. And then to the left, we have a person reading a book in a dim room. Take a second. All right, so if you guessed getting up out of bed and drinking a nice warm non-caffeinated beverage, then yes. We do not want you to stay in bed, and remember, avoid electronics. And this ties into tip number 1 where I talked about the bed being used for sleep and sex only. If you lie in bed and worry, that's a fairly active thing. If you're using electronic devices, the light that they emit can actually disrupt your sleep. So neither of these are good activities to do if you're having a hard time falling asleep at night. And then this one, maybe. So if it's a non-stimulating book and you're doing it in a dark room and it is not an e-reader, then you'll probably be okay. It'll actually help you fall asleep. So the whole point of this is if you're in bed longer than about 15 or 20 minutes, get up, get out of the bedroom, go do something quiet in a dim room until you do feel sleepy again, and then try to go back to sleep. If at that point you still can't fall asleep after 15 or 20 minutes, get up, rinse, repeat, and keep going until you're able to fall asleep. All right, so let's talk about the last tip. Tip number 7, when it's time to get professional help. So say you've done tips number 1 through 6 and you're still not sleeping as good of quality sleep as you're looking for. Let's talk about what options are out there professionally. So option number 1, go see a therapist. There are a lot of therapy techniques that are designed specifically for sleep, insomnia, especially cognitive behavioral therapy can be really helpful with this. Option number 2, you could go see somebody who specializes in biofeedback. Biofeedback is very good for sleep and just general relaxation and increasing calmness. Or 3, you can go see somebody who prescribes medication. There are certain medications out there that can help you with sleep. Just a word of caution though with that, of course, talk about any side effects or things like that with your medical provider, and then keep in mind that many of those are really designed to be short-term solutions. So if it's something that is disrupting your sleep temporarily, maybe an all right idea, but if you know it's going to be a longer-term problem, it may be a good idea to start considering some of the other interventions. All right, everybody, that's it for today's toolbox. I hope you found it helpful, and thank you so much for watching. And for those of you who have subscribed, thank you so much for your subscription. And as always, if you have questions or comments, or if you're hoping I'll cover a particular topic, feel free to drop me a line, shoot me an email, or log on to my website and just let me know what you're looking for. All right, take care.